So in today's event, we have shared with you information on the 5 effective roadmap policies and 6 strategies that have strong evidence that they improve the health and well-being of infants and toddlers and their parents. But a state's policy choices don't operate in isolation from one another. Instead, the policies interact to create a system of support of varying generosity for parents and children. Tax credits and near cash support, such as SNAP, they provide valuable resources for families. However, our analyses show that state minimum wage policies and child care subsidy policies are significant drivers of the variation across states and the amount of resources that a working parent has available to support their family. In the following graphics, we simulate the level of resources available annually to a single parent who has an infant and a toddler, and they work full-time at a minimum wage job. And they use a child care subsidy to leave their children in center-based care, and that center charges the equal access target rate, which is the 75th percentile of the state's market rate survey. And so in this simulation, we combine a state's minimum wage, the out-of-pocket childcare expenses, their nutrition benefits, and tax credits to illustrate how the level of resources available to the stylized family varies across states. So this figure illustrates the wide variation in available resources due to state policy choices. In particular, the working parent has over $46,000 in annual resources to provide for their family if they live in the District of Columbia. And additionally, that parent in DC has access to paid family leave when their children were born, and they're eligible for Medicaid. But by contrast, because of low minimum wages and high out-of-pocket childcare expenses, the same working parent would have just over $22,000 in annual resources for their family if they lived in either North Carolina or Georgia. The parent would also not have access to paid family leave or Medicaid. So let's take a closer look at the states that's ranked first and last in the resources for this stylized family. The minimum wage in DC is currently $16.10 an hour, and this compared to only $7.25 in Georgia. From earnings alone, the working parent has over twice the resources in DC as they have in Georgia. And this is a substantial difference, even after taking cost of living differences into account. But in order for that parent to work and earn those wages, they have to leave their infant and toddler in childcare. And in this example, they leave them in center-based care that meets that equal access target of the 75th percentile of the market rate. In DC, the working parent pays less than $1,000 in co-payments for both children, and that's over the whole year, and no additional fee to cover the difference between that subsidy and market price. This means that the parent gets to retain most of their earnings from their minimum wage job. But in Georgia, the working parent's required to pay just over $750 in copay for those 2 subsidized slots each year, but nearly $10,000 in additional fees to leave their children in quality care, which wipes out nearly all of their meager pay. And so they're left with less than $5,000 in earnings despite working full time. If you were this parent, what would you do? It's likely you would either decide that work just doesn't pay, or you would find cheaper and perhaps lower quality childcare arrangements for your children. So if we add in nutrition benefits and state and federal tax credits, the resources available to that family in Georgia do increase substantially, from less than $5,000 to over $22,000 a year. However, this level of resources is still less than half of what that same family would have access to if they lived in DC. In DC, the family receives fewer SNAP benefits and a lower federal tax credit because of their higher earnings. But DC's state earned income tax credit boosts their annual resources by over $2,300. And in total, the working parent in DC has more than $46,000 in resources to provide for their children. And most of those resources are from their earned income rather than government benefits. It's also instructive to see how resources vary when earnings are the same, but other policies differ. In this example, we show how the same working parent's resources differ whether they live in North Carolina, South Carolina, and Tennessee. All three states have the same federal minimum wage of $7.25 an hour, so the parents' earnings are the same regardless of the state they live in. And working full-time for the full year, the parent earns only about $15,000 a year, which leaves their family of three in poverty. To work full-time, the parent has to leave their children in childcare. And this graphic shows how states' childcare policies impact household resources and potentially work decisions. In North Carolina, the parent must pay over $1,500 per year in copays for their two children and an additional $8,600 annually to leave their children in quality care. And these out-of-pocket childcare expenses basically eviscerate their earnings, leaving them with less than $5,000 in resources despite full-time work. By contrast, in South Carolina, the working parent has to pay just over $600 in copay for childcare and no additional fees, which leaves the parents with most of their meager earnings. That same family in Tennessee would experience something in between. They'd be required to pay over $1,800 a year in copays and an additional $1,800 annually in additional fees for that quality care rate. So rather than close to $15,000 a year in resources, that Tennessee family has just over $11,000 a year, or less than $1,000 a month, even though the parent's working full-time. When we added nutrition benefits and federal tax credits, that boosts each of the parents' resources substantially. However, the working parent in South Carolina has over $8,000 more in resources to provide for their children than the same parent would have in North Carolina. And this difference is driven entirely by childcare subsidy policy choices. In this final example, we see how changes in subsidy policies impact household resources for working parents. Those top two bars illustrate the changes in resources between last year and this year that our stylized family of three has in Michigan. This past year, Michigan substantially increased its reimbursement rates, and it eliminated out-of-pocket childcare expenses for families at this income level. And although the state's minimum wage increased by only 22 cents per hour, the family's total resources increased by over $6,500. That increase is equivalent to approximately a $3 an hour increase in the minimum wage, but it all came from a reduction in out-of-pocket childcare expenses. You can see that Minnesota also reduced out-of-pocket childcare expenses and slightly increased its minimum wage. However, despite having a minimum wage this year that's 50 cents higher than Michigan's, the working parent in Minnesota has nearly $3,000 less in total annual resources to provide for their family because of their higher out-of-pocket childcare expenses. So we're in the process of creating a calculator that your state can use to illustrate how your state policies choices would lead to changes in household resources. And you can see more in the roadmap of all of the state's policy choices and how they intersect. But it's clear from these examples that policy choices matter, and they lead to huge differences in the resources a working parent has to provide for their family. Whew. Well, wow. When you see all the progress that state policy leaders have made this past year toward implementing effective policies and strategies that research shows us that will improve the lives of children and families in their states, it's a bit overwhelming and really impressive. I realize there is so much more that needs to be done in every state to support children and families. But it's important to recognize the accomplishments thus far and to learn how states are making it happen. There truly is no more important investment that we can make. And we know that investing in these earliest years will not only improve outcomes in the short term, but it will have long-term benefits, not just for the children, but for all of us. So I want to thank you. I want to thank you for your dedication to this vital work. And I want to make sure that you understand that we are here to serve as a resource for you. And we really hope that the roadmap is a useful tool to help you set policy priorities and choose the best solutions to meet your goals, and to learn how to most effectively implement your state policies and strategies so they have the biggest impact on children and families, and that they can reduce long-standing disparities in access and outcomes. So reach out to us and let us know how we can help. Whether it's presenting your state's roadmap to educate others in your state, providing consultation on state policy actions, analyzing the return on investment of your policy choices, or evaluating the impact that your policies are having on the well-being of children and families in your states, we're here to be a resource for you. So thank you again. Thank you so much for the important work that you do. And we look forward to recognizing and celebrating all of your progress next year. Thank you again, and have a wonderful afternoon.